Testing 1, 2.
I hear you loud and clear.
Okay, good.
Everybody's good.
Okay. All right, here we go. 1, 2, 3. Good evening, everybody. This is John Marola from Keeping It Real Section 5 Football, and this is our season number 2, episode number 15 already, season number 2, and overall, this is our 68th episode of Keeping It Real. So, like I've said before, we're just moving right along and just trying to get a little better and better. Before I introduce our guest in the middle, I have to introduce my partner to my far right, Section 5 Hall of Fame coach from East High, Coach Paul Brigandi. Coach.
Thank you, John, and welcome, Chelsea, to the podcast. This should be a very interesting topic today, and we're looking forward to it.
And our guest in the middle from BURD Physical Therapy. She has a couple places around town that we'll talk about, and basically what we'll talk about is how she got involved in this, where she is at now with it, and talking a little bit about sports injuries and letting people know, giving them information about, sports injuries and proper ways of treating them and taking care of it. Before that, let me just go back and tell everybody, for all our people out there, everybody that has subscribed, I have to say thank you. Thank you for subscribing to our channel. If you have not subscribed to our channel, just go hit the subscription button down on the lower right-hand corner and just hit that. Everything's free. You don't have to pay for anything. And just follow us on our platforms. We're on YouTube, Facebook, X, Instagram, and Dave Lanning, who's not here today, his favorite one is TikTok. So Dave loves that TikTok. So anyways, we're going to start off right now. And, Paul, you ready?
Sure.
All right.
Chelsea, tell us a little bit about your background, where you grew up, and your interests maybe in athletics, and then how you got started in physical therapy.
Absolutely. Yep. So I grew up in Greece, born and raised in Rochester. I went to Greece Olympia, and that's where I had my first injury. I've always played soccer since I was 5. Mm-hmm. I also did other sports, you name it, dance, track, cheerleading. But soccer has always been my true love, and grew up in a football household. My dad coached, played. Both my brothers played through college. So I was always, that's actually how I got into cheerleading, was because they played football. Really, I enjoyed watching the games. So yeah, I grew up loving sports, and I found myself having my first injury playing soccer as a freshman. It was like the first or second game, unfortunately, and it sidelined me for the entire season. And it also was my first experience with physical therapy. I didn't know what physical therapy was at all. And as much as I didn't enjoy going when I was 14, I knew that it was necessary to kind of get through that injury. My primary goal was obviously to get back on the soccer field. Yep. So I was very adamant about doing my exercises, and went, to every single session ready and eager to get better. And I remember being so excited when I got cleared to just participate in warm-up in the last game of the season. I couldn't play on the field, but I was able to shoot the ball around and just run around the field and kind of, be in that environment again. So, that was my first kind of experience having to sit back and watch on the sideline, and it also got me interested in what physical therapy was. So when I was a junior in high school, I was able to take an elective called sports medicine. And I remember this class so well because it just laid out all of the options when it came to working not only in sports, but also in like the healthcare setting. And it allowed us to kind of lay out certain ideas that we maybe wanted to get into, whether it was athletic training, whether it was nursing, whether it was physical therapy or physician assistant. And I ended up leaning toward PT. And as a senior in high school, I got into the program at NAS, right into the program at Nazareth, which was a 6-year physical therapy program where at the end you earn your doctorate in physical therapy. So I was fortunate enough to know at 18, barely, that what I wanted to do. And as an athlete, I played soccer at NAS. I was able to play and participate in the PT program. I was able to work on campus as a student athletic trainer, which was very exciting, where I actually got paid to help with stretching and taping and participating in the games on the sidelines and on the court. So I was really like immersed in the whole sports setting at Nazareth too. And I got to learn about other sports that we didn't offer at our high school, like men's volleyball. I was not very I didn't know a lot about lacrosse, which NAS has a big lacrosse program, so that was really fun to watch. Field hockey. So sports that I wasn't really, used to seeing. But I think what I loved most about the physical therapy side of things was when I went as such a young kid, I could tell right away that these people, number one, they were helping others, whether it was an older person, whether it was an athlete, helping people to get back to doing whatever it is that they want to do. They're also on their feet. They're using their hands. They're doing things that involve other things besides just sitting and typing at a computer. And I knew for a fact that I did not want to be at a desk job. Yes, I actually did an internship my summer going into my senior year. I won this award that it gave me this internship for the summer, and it was at a desk job. I was an intern at a communications company, and it involves me just sitting at a desk for 40 hours a week. And as much as I appreciated that was a huge eye-opener that said, okay, that you are exactly going in the right direction of not wanting to do this when you get older. So the program was very tough. It was not easy by any means, especially being a student athlete. But I think that helped me get through the program more because I was so focused on the time that I did have to study. I had friends in the program that played soccer with me as well. And it's not only a great PT program, but a great soccer program as well. So I think being D3, they prioritize education. School comes first for the most part, unless you're traveling or something. But they definitely put that first, and it helped me to kind of get through the tough years as a student.
Well, it sounds like it's a very intensive 6-year program. How much time was classwork just for yourself, and then trying to basically, jockey your time to have time for field work with the sports teams along with your classwork that had to be very intense.
Yeah. As an undergrad student, it's basically 3 years of undergrad, 3 years of grad school. So the first 3 years of playing soccer, I was doing the prereqs. So biochem, organic chem, anatomy, all of those classes to kind of prep you for the grad program. Those were definitely challenging. A lot of those classes are classrooms, but also lab too. So I did not have much downtime especially in the fall semester. I would basically finish classes, stop at my dorm to eat really quick and go to practice. And then it was, games throughout the week, games on the weekends. We had seasons where we traveled more than others. So it was a lot of studying on the road. Right. Again, we had little study groups on the bus and in the hotels. Spring semester was a little different. Definitely had more free time. We did do spring ball, but it was much more free. We had required workouts and stuff like that, but I think it helped me it made me realize actually the fall I almost did better in school because I had less time to, goof off. And then in the spring I definitely had more free time. So I appreciated that. But the senior year was the true test because that was actually the start of my grad program. It was tough. It was very, very tough. So I didn't have as much fun, I guess, or free time to have fun my fall semester senior year, but we made up for it in the spring.
There you go.
They gave us time off and breaks from tests and stuff, so we could kind of let loose. But
that's good.
Well, so you obviously worked with a lot of the teams. You saw a lot of different injuries, and a lot of them are sport specific that you deal with. And tell a little bit about because I know, just like how you had mentioned, every time an athlete gets hurt, they want to get back out onto the field or onto the court, whatever, and they want to be back on there. Their coach wants to, and you got to basically, use good judgment on just the whole recovery process.
Absolutely.
And what were some of the things you're looking for before you would ever want to put someone back out on a court or a field? That they're in your ear. I'm feeling good. I'm feeling good. But you need to test out and show us.
Absolutely, yes. In PT, we get to a point where the person needs to be able to fully participate in their sport before being cleared. And sometimes that involves us more than even the doctor. Post-op patients, the doctor usually will clear them. But when it comes to just feeling good and feeling ready to participate, the student athlete is usually wanting to participate sometimes sooner than they're able to. So as a PT, what I do is I put the person through kind of sport-specific training where – if they're going to be if they're a basketball player and they're going to be doing a lot of cutting, a lot of jumping, we're simulating that in the clinic. I want to make sure that person is not only not complaining of pain, but also doing so properly, maybe with good form. They're not showing any type of compensation or, sometimes you can just tell by looking at a person, whether it feels good or not.
Yep.
So I can't stress that enough that needs to be done in the clinic because that's a perfect setting where we're telling them focus on, doing these agility exercises. But when you're in the game, you're not focusing on technique. You're focusing on getting the ball or getting the tackle or doing whatever you can do to win the game. So you need to be throwing a lot of simulation at them to kind of get them to that point in the clinic, what they're going to have to do on the field or on the court.
Yeah, I think that's a great point, and one of the advantages sometimes, obviously, working with the athletes, they're used to hard work. You can push them maybe a little bit more than you may to someone who doesn't have that push pain, threshold. And, a lot of it was to, get those kids ready.
Absolutely. Yep. And you find that you get to know your patient quite a bit. We spend a lot of time with patients and everybody's different. So sometimes you got to rein it in and, maybe not push people as hard as they're ready for. But again, if they're going back on the field or they're going back on the court, you need to get them ready. So you got to be the bad guy sometimes.
Yep. Yes.
We spoke briefly in the room before you came on. We talked about, you're seeing most of these high schools, colleges are all going with the artificial turf fields now. Instead of we grew up with the grass, and you see it, and you see a lot of turf-related injuries, and I guess what are some of the most common ones you're seeing that kids are coming or adults are coming with for physical therapy for something that you could say, probably was more turf related than grass?
Yeah, I think I've seen it more almost like with football players than any. As a soccer player, we're used to playing on turf. We wear turf cleats or turf shoes, whether it's playing indoor or whether it's playing on a field outside. We typically don't wear cleats on that type of ground. Football players, for instance, like knee hyperextensions, that's one thing that I've seen a couple times where I think just planting and with the cleat being a little bit longer, it's kind of almost adhering to the turf. It's just not the safest. And also we're just not used to it, a lot of these athletes. It looks good, it's clean, it's easy to, maintain, but at NAS even, our stadium field has grass. It's absolutely a difficult thing to keep looking good and keeping up maintenance on it, but it's safer and it's definitely, I think it's more fun to play on as well, but I know I'm almost a little bit disappointed they're kind of gearing more toward the artificial turf. I would say probably knee or ankle injuries are the most common thing we're seeing, again, because they're kind of getting almost like stuck in that turf.
I would see that. And then the other football-related injuries is we do see shoulder and neck. And, how much, you know, how many of those type injuries have you had the opportunity to work with, you know, again, some rehabbing and getting kids ready?
Yeah,
in those fields?
Sometimes it's even like lifting related.
Oh,
you
that
know?
could be too.
Yeah.
Their back, they
Yes,
point.
Yes,
we had a kid. Gosh, I don't even know what he was lifting for. He's a baseball player, but he was lifting weights that were way too heavy for him and ended up tearing his pec muscle. Needed surgery and everything like that. So shoulders, yeah, I mean, we definitely see a lot of shoulder injuries. I would say like subluxations, where, you know, the shoulder might kind of come out of place, and then you need to do exercises to sort of strengthen it to keep it back. Your shoulder is meant to be extremely mobile, but the second you have an injury, it's susceptible to it again, especially if it's like a subluxation. So our goal is to try to avoid surgery as much as possible. Surgery sometimes is inevitable. Unfortunately, sometimes we need to have it, especially if I had a patient one time, every time she put her arm in a shirt, her shoulder dislocated.
Ooh.
She needed to have it. She needed to have her labral repaired. So that's, you know, there's a time and a place for it. We do as much as we can to kind of get the person back in good form, whether it's through strengthening or exercises, stuff like that. But that's our ultimate goal, is to try to, you know, work more in the conservative direction. But I would say absolutely, like, lifting mechanics, but also technique when it comes to hitting.
Yes.
I can't stress that
Yes.
enough. My
Yep.
son loves football. He's 7. He's not doing tackle yet, but you bet when he does, he's going to be absolutely learning the technique before he does.
You bring up a tremendous point with the technique, and you have all these, you know, and we're talking specifically football, which our show is. You have all these kids lifting in the off season, you know, and they all want to get bigger, faster, stronger. But proper technique is so important, because they can get, you know, injured just trying to do, like you said, lifting too much.
Yes. Oh my goodness, I can't stress that enough. I had a person that I worked very closely with when I was in high school for strength and conditioning, and I give him a lot of credit because I didn't know, as much as I wanted to go into PT, I didn't know how to lift weights properly. And that is such an important thing to start doing. Not super young. I don't usually recommend kids lifting when they're, you know, in middle school, but at least working on body weight technique and stuff like that. Talk about injury prevention, that it is absolutely huge to target, you know, certain muscle groups to try to do as much as you can to avoid injury. I've been playing soccer I still play soccer. I've had my fair share of injuries. I will say, as an adult, I've had almost more kind of nagging injuries because I'm not on top of my game. I don't lift regularly. Believe me, I've fallen off the wagon with that stuff. But the injuries I have had are more traumatic things. I'll break a bone or I'll do something like that. But I'm talking, if you want to avoid those ankle injuries, those knee, unfortunate ACL tears, things like that, you can reduce your chances of that happening if you are doing the right things.
You know, and as much as strength training is so important, we sometimes neglect the flexibility.
Oh, yes.
And that's a whole other area that you know, and I know with you guys with physical therapy are trying to increase range of motion, flexibility, and sometimes that is neglected, you know, in some of these off-season programs, you know, with that. So maybe we can touch on a little bit on the flexibility portion of what you do.
Yep. Yeah. You know, oftentimes I'll see patients that come in and they either, and this is because people enjoy working out and they usually find something they like and they stick with it. So my runners are heavy in the endurance, you know, low in flexibility, low in strength. And then I have people that only do yoga or that only do strength training. You have to do a little bit of everything. It is so crucial. And it's not just stretching. It's getting into a good routine of dynamic warm-up, of cool down. I hated cooling down in college. My coach made us do like a 10-minute cool down run, stretch, everything like that. And it was, I just wanted to go eat or like go, you know, say hi to my parents, whatever it was. But, you know, it was very, very important. And I know why. And sometimes we don't listen to what we need to do. But yes, we have to come in, you know, come into the mindset of having a good routine all around. So my male athletes that come in especially, you know, they don't want to stretch. You know, and it's not even just stretching, it's mobility exercises too. It's hip mobility to work on maintaining good, force through our knees and through our back. Sometimes if our hips are tight, we can have, issues up the chain or down the chain. So it is extremely important. As a soccer team, and actually all the teams at NAS, we would take yoga classes once a week or a couple times a week. Our one of the ladies that worked in the spirituality departments, she was a yoga instructor, and she would take every team and do a class that was focused, again, on what they might have needed for their sport.
The other one I want to talk about a little bit is pre-testing measurement. You see a lot of injuries where the quad to hamstring ratio is so disproportionate, and you wonder why some of these injuries, and they're not, just to your point, with being balanced and at least close, it's such a discrepancy.
Mm-hmm. Yep, especially in the ACL. There's a lot of research that shows ACL tears could be prevented by, kind of balancing that quad to hamstring ratio a little bit better. And it is true. We oftentimes neglect what's called the posterior chain. It's glutes, hamstrings, and calves. Quad dominant, usually soccer players, runners, oftentimes. When a muscle is tight, it's often weak. Mm-hmm. So hamstrings are kind of the chronic, tight, weak muscle. But yeah, that imbalance plays a role all throughout your body. Even up the chain, looking into the shoulder, it's not always an issue with strengthening the front part of the shoulder, the delts and the pecs. It's the upper back that gets neglected. And what happens is it causes an imbalance when you raise your arm overhead. Those rotator cuff muscles, the muscles in the back part of the shoulder blade, are not firing like they should. So one of the first things I ask my shoulder patients that come in is, I know you lift, but do you do anything upper back? Oh, I do rows. Was that it? That's all they're focusing on. And there are so many other things you could do besides, working on your delts and your pecs to kind of look bigger, So that imbalance is so important for injury prevention.
Talk to us a little bit about your facilities now. When did you open your first one?
We opened in March of 2019, so we just celebrated our 6-year anniversary.
Congratulations.
Thank you. Yeah, I was in Brighton. I always knew I wanted to open my own practice. I worked in multiple settings, whether it's home care, skilled nursing facilities. I've always loved outpatient, but it's tough to work in an outpatient setting. You have to see a lot of patients. There's high burnout rates with PTs. Mm-hmm. There's just not a lot of, the reimbursement rate's not great with insurance. So I kind of took things that I liked about it and then didn't take things I didn't like, and we started our own business. So it was a one-man show for a while. I was the only PT for about a year, and then actually had my daughter in 2020, so she just turned 5, and that's when I hired my first PT and office manager. And then since then we've opened 2 other clinics, one in Fairport and one in Webster, and now we have 18 employees total.
Wonderful.
So we've grown quite a bit in 6 years.
That's awesome. Mm-hmm. That is, starting from Greece Olympia to like where you are.
You got 3 going, and
would you ever thought that back then? Going up through Olympia and then.
No, I would not. No, I actually go to career day still there.
Sometimes. Oh, do you?
Yeah.
Good.
So, no, I think you always have this kind of inkling of what you want to do, but I didn't think that this would take off the way it has. Mm-hmm. I mean, there's a huge need for PT. It's tough. It's not easy to manage that many people and also kind of manage the patients as well, because whenever something goes wrong, you're the person that, the go-to. But no, it's been very worthwhile.
We have a saying as coaches, assistant coaches to the head coach. So we always tell the head coach, your name's on the side of the truck. So when a grumpy parent comes in, or a client, I'm sure of yours, or somebody, they're like, they want to talk to the boss.
They do, yes.
And
whether it's a billing issue or what, I'm like, I try to keep everybody happy. Unfortunately, there are people you can't make happy no matter what you do, but I think just treating people like you want to be treated is always a good way to go about it.
Now, just you talked about, the program at Nazareth. What other local colleges and what other colleges in the state, if someone was interested in getting into physical therapy, where would they go for opportunities to pursue it?
Yeah, there are a lot of options. Nazareth right now is the only PT program in Rochester.
Oh.
I've heard a little bit through the grapevine that RIT and U of R are potentially starting PT programs, but not currently. The other ones, so there's a few in Buffalo. Damon and Duville also have programs similar to that of NAS. UB has an undergrad program that you can stay for the grad portion as well. You just have to reapply. Ithaca is a very well-known program as well. And then Utica as well. And then Upstate Medical in Syracuse also has a grad program too. So there are options to go to state schools like Brockport, for instance, go for 3 years and then transfer into a PT program as well. So there are a lot of options for getting into PT.
Now, I saw, I knew at Brockport, when I coached up, they had a lot of the athletic trainers. They had an athletic training program, and kids were using that is, to get involved. I remember when I first started coaching the city, we had one athletic trainer for the whole city.
Oh my goodness!
And now pretty much every school has an athletic trainer.
Yes.
Yeah. And that was long overdue. And the importance of having athletic trainers, dealing with the various sports programs.
Yes, we had one. Luckily, I actually run into her now and then when I play soccer, but. Yeah, we were fortunate enough to have one. My husband grew up in a small town outside of Buffalo, and he was shocked to hear that we had an athletic trainer in high school because he tells me about injuries, and I said, "Well, what did your trainer tell you to do? Did you go and get it looked at? Did you?" No, he just kind of he rotated or broke his collarbone in his junior year of high school, and it just he didn't have any guidance on what to do. He went to the doctor and kind of just was left hanging for a while, and it ended up kind of hindering his recovery. And I felt bad hearing about that because he should have had somebody to kind of guide him in that. They had someone for games, but never anybody that would show up
day to day.
No. And it was a small school. I get it, but it should be, and hopefully now it is available to all these students. But as young kids, you don't know what's going on. You don't know if it's a sprain or if you need to go to the doctor, or if you need to get X-rays, and so.
Well, I just think that's a whole, avenue that kids can go that are interested in physical therapy, athletic training. That there is a huge need.
Huge need, yeah. And that sports medicine class was so helpful because I kind of was teetering between the two. You can actually get an AT and a PT license, like a combined. But I knew immediately that I wanted to go that PT route. I wouldn't have known if I hadn't taken that class, though. So,
Johnny, I know you want to ask that $1 million question about ice, heat. When do you use what and why?
What is your thoughts, your thinking process as far as I have an injury, I turned my ankle. What is the best? You talk to 10 people, you get 10 different answers.
Totally.
And a lot of it, again, may change depending on the duration you've had that injury.
Yes, absolutely.
Yeah.
That's
There's
a
a
good
lot that goes into people don't say.
Well, the ankle is actually the example I use. If anything is swollen, warm to the touch, you just sprained it. It's a bad sprain. You need to ice it. You need to elevate. You need to compress it, put some kind of ACE bandage over it, kind of, control that swelling. That happens most often with the ankle. You don't see that with a ton of maybe a knee injury or something like that. Yeah. But really, ice, we recommend heating before you do an activity and ice at the end. But that is a great example of you need to ice. We call it RICE, actually. Rest, ice, compress, and elevate. There is a little bit of a movement away from ice right now with some ortho surgeons in the area. They're actually moving away from even taking NSAIDs, like anti-inflammatories. But an acute injury like that, absolutely, you need to do those things. Maybe take some anti-inflammatories, whatever your doctor recommends. But that joint needs to rest. Non-weight bearing, usually crutches, trying to keep weight off of it. Usually because ice and heat are so superficial, they're not kind of getting down deep into the cellular level, so there's not a huge impact that either of them make. They usually feel good. Ice will feel good on a sore ankle. Heat, who knows? Sometimes people might think heat feels good, but typically you don't want to put heat on a swollen joint.
Now, the things that I've heard is 20 20 minutes on, 20 minutes off, 20 minutes on, 20 minutes off, 20 minutes on, then you're done. And they used to say, when you're home watching TV, have it elevated and do the 20 and 20s.
Yeah. They do recommend taking the ice off for a period of time, kind of letting that joint go back up to room temperature and then reapplying it. Some people actually alternate between heat and ice.
That's the other one after that one. Yes.
That's a kind of, there's a theory behind that as well. After a surgery, that is 100% my recommendation is usually 10, 15 minutes, 20 minutes at the most of ice. Take it off for that amount of time, put it back on. But you don't need to do that for.
I remember when I lost my mind. There was something so pleasant about that place. Even your emotions have an echo in so much space. And when you're out there without care, yeah, I was out of touch. But it wasn't because I didn't know enough. I just knew too much. Does that make me crazy? Does that make me crazy? Does that make me crazy? Possibly. And I hope that you are having the time of your life. But think twice. That's my only advice. Come on now, who do you think you are? Bless your soul. You really think you're in control? Well, I think you're crazy. I think you're crazy. I think you're crazy, just like me. My heroes had the heart to live the lives I wanna live, and all I remember is thinking I wanna be like them. Ever since I was little, it looked like fun.